Wes Streeting joins me now. Good morning, Mr. Streeting.
Good morning, Trevor.
You've become Secretary of State. You've heard the Secretary of State and on their response. He doesn't seem quite yet to have decided that there are going to be more restrictions. Are they right to wait and see what the data will show?
Well, two things. Firstly, if there's one thing that the SAGE report, the minutes published yesterday, tells us, if there's one thing that our experience in the pandemic tells us, is that action sooner rather than later means that the strength of the restrictions and the impact on people's lives, livelihoods and liberties is lowered. So action sooner rather than later would be better rather than worse. The second thing to say is, listening to Sajid Javid this morning in that interview, he looked like a hostage to his own party, and that's because he is. What we saw this week in Parliament with the huge rebellion of over 100 Conservative MPs on what were actually quite modest measures tells us that the Prime Minister has a big problem when it comes to the crisis of confidence in his leadership within his own ranks. And crucially, that is impacting on the government's public health response. So Sajid Javid looks like a hostage. The good news here is that the Labour Party is here to rescue him from that situation. He doesn't have to negotiate with the people holding him to ransom on his backbenches, because we will act in the public interest. We will put public health before party politics, and we will work with government scientists, medical advisors, as we have done throughout the pandemic, to put public health first. And that should be the only focus of the government. Well,
that is immensely generous of you. But the truth is, you disagree on some of the detail. But basically, you support what Johnson and Javid want.
Well, we'll be guided by the scientific advice. We're hoping to meet with the Chief Medical Officer and scientific advisors today for a briefing on where we are, to test some of their assumptions and to think about what might be necessary. There are areas where we think the government can and should have gone further already, actually, which is not about restrictions. Statutory sick pay should be higher because there are lots of people who are supposed to be isolating but feel they can't afford to do so. As a result of the very sensible advice that Chris Whitty gave the country earlier this week, lots of people have voted with their feet, have made different choices about how to spend their social interactions, whether they're going out socialising. The hospitality industry and others have taken a hit through no fault of their own, and support there is needed for the industry. The government could, for example, with these COVID loans that people have taken out, give people a bit of a repayment break, help get their finances in order. So there are things the government can and should be doing which they're not. So it's not just the case that we're voting to support measures in the public interest. We are encouraging the government to go further to help people who are feeling pain in their pockets.
Yeah, but with respect, that's all the nice stuff. It's everybody's in favour of giving the public more money. Will you be in favour and will you be voting with the government if they bring in further restrictions, for example, a further lockdown?
Well, I don't think anyone wants to see a lockdown. I hope we don't have to go.
But if the data tells you that that's
lockdown,
what's needed, as scientists are beginning to say this morning, will you be ready to vote for a further lockdown?
But as I say, Trevor, I don't think that a lockdown would be necessary if the government takes action sooner rather than later. So, I'm not trying to be difficult about this. We're going to see the Chief Medical Officer and the scientific advisor.
When you say
we'll follow the advice.
Well, when you say sooner rather than later, the scientists are saying today, this morning, get on with it. And I don't quite understand what you're saying. What are you waiting for? To say, let's get on with it. Either you believe the scientists or you don't.
Well, with respect, the government had this advice on Thursday in the form of the SAGE minutes. The government have access to far more information, options, advice than the opposition do. I don't think unreasonably, given that I saw the SAGE minutes last night, that I want to speak to the Chief Medical Officer and scientific advisors so that we can come to an informed view, and I hope that will be today. The question is...
so we might hear something from...
The question is... Well, I think...
we might hear something from Labour tomorrow.
The question is, why is it, having received that advice on Thursday, the Prime Minister has said nothing, done nothing? Well, I can tell you why. It's because he's hiding from his own backbenchers instead of leading. And that kind of weakness in place of leadership should really concern the public, because I think people out there know that measures are necessary. All they want to know is what measures, when, and how can I plan for them. Contrast that with what's going on in Wales. Mark Drakeford, the First Minister, set out a plan that takes Wales right into the new year. I dare say people won't necessarily like measures. Who does? but at least people have some certainty. They know he's doing the right thing for the right reasons, and they can see what that path looks like. Why don't we have a plan for England?
You've told me you're meeting the Chief Medical Officer?
We hope so. We're due
today.
to have a Cabinet Office briefing.
So let's say 48 hours. So we can expect within 48 hours for Labour to take a view about whether we need further restrictive measures or not.
I hope so. I mean, if the Prime Minister isn't prepared to lead, we've shown that we are prepared to lead, and we're prepared to do what is necessary in the public interest. We put public health before party politics early this week. We will continue to do so again. I think it would be preferable, by the way, for the government to have a plan and for them to pick up the phone and work with us in the national interest. We're prepared to do that too. But the question is, how is it, having known this information on Thursday, that the government have failed to say anything, do anything? In fact, the only thing, beyond the interview we heard from the Health Secretary this morning, his other big intervention is an op-ed in the Daily Telegraph today. Why? Because he's talking to his party, not talking to the country. He's negotiating with his backbenchers. He's not working in a bipartisan way to take the action that might be necessary to get the country through this. And that's what I think we should be concerned about. The Prime Minister's weakness is now undermining public health.
Well, let me ask you a question about something that might be puzzling some viewers. If you think that the Prime Minister's essentially the biggest obstacle here, why are you voting consistently to support his measures and essentially keep him in office? Wouldn't it be the best thing for a responsible, patriotic opposition that thinks that Boris Johnson is not fit to lead, quote your leader, who is the wrong person to be guiding us through this crisis? Wouldn't be the most important thing, number one priority, get rid of Boris Johnson?
If there's a motion of no confidence tomorrow, we'd be voting for that. Because Trevor, you know as well as I do, had Labour played party politics in the way that you described with the votes earlier this week, the measures would have fallen, public health would have been weakened, and people would have rightly said, why is Labour playing party politics with public health? You also know, if we tabled a motion of no confidence in the House of Commons tomorrow, the Conservative Party MPs, including those who think Boris Johnson is a busted flush and an albatross around the necks, they'd vote against the motion because they'd pull together. So look, there are lots of armchair critics who say, why don't Labour do this? Why don't Labour do that? The answer is because we thought it through and we've realised that these are futile measures. We're not going to play party politics with public health. And what we are going to do is show the leadership and responsible leadership that the country would expect to see from us. And that's what we've done this week.
Do you think if the government seeks further restrictions, do you think the public is going to fall in line again?
Well, I think the press conference earlier this week with Chris Whitty showed us that while people have lost trust and confidence in Boris Johnson, they do trust, as we do, the Chief Medical Officer, they do trust the Chief Scientific Advisor, they do trust the NHS. So in the end, I trust the British people to do the right thing. I think what's reprehensible here is that Boris Johnson, through his own actions and the actions of those people around him, have undermined trust and confidence in public health messaging from the government at a critical time. And that's why I think, to be honest, when it comes to the next phase, Boris Johnson, if he's determined to stick around like a bad smell, needs to take a step back and push to the forefront of public health messaging, clinicians, people on the front line of the NHS, because people do trust them and they do trust their experience. And so I think in the end, the public will do the right thing. We're a law-abiding country. But at the moment, people are making their own decisions because the government isn't leading. All
right, this is a politics show. Let's talk politics. And let's talk about the by-election this week. To give him his credit, Boris Johnson took responsibility for the Tories' loss in North Shropshire. When is your leader going to take responsibility for losing nearly 9,000 votes in this by-election? Last time round, you had more than 12,000. This time, you didn't break 4,000.
I don't think we're disappointed by the result in North Shropshire.
What, you lost 3/4 of your vote and you're not disappointed?
I think it's a significant defeat for Boris Johnson. And what North Shropshire shows us, Trevor...
Steady. You were second in this seat. The Lib Dems walked straight past you. Come on.
I think what North Shropshire shows us, Trevor, is that political parties are perfectly capable of making informed judgments about where to spend their resources, and voters can be trusted to make the decisions that give them the outcome that they want. In this case, removing a Conservative MP. And I'm not the slightest bit disappointed by the result in North Shropshire.
OK, you're obviously having a laugh here, but there is a serious point here. Doesn't this demonstrate that if you are absolutely as serious as you purport to be about Boris Johnson's failings, that the Labour Party, the Liberal Democrats, the Greens, all now have to start thinking, if they really mean what they say, that it's time to start thinking about an alliance that would actually put you in power, because that's the only way to get rid of this person that you never cease to say, day in, day out, is not fit to lead this country.
I don't think that voters like the idea of backroom deals and pacts between political parties. I think voters are perfectly capable of making their own informed choices about the outcome that they want to see. So, looking at the lie of the electoral map, there will be some parts of the country where getting rid of a Conservative MP, the route to that, the best route to that, the easiest route to that is to vote Liberal Democrat. There are far more places in the country where the route to getting rid of a Conservative MP and delivering a Labour government is by voting Labour, and voters can make those informed decisions. No, I don't think that's a choice, actually. If Boris Johnson leads the Conservative Party into the next general election, more for the Conservative Party, but that's for them to worry about. I think what the Labour Party has shown this week in particular, but since Keir Starmer became leader, is we've got a serious leader with a serious team capable of governing the country. We know we've got more work to do to win back trust. Don't want to give your viewers the impression we're in any way complacent about this, but we're determined to do that work. We're determined to win the trust and confidence of the people. We can do that without backroom deals, and we'll put our best foot forward and let the people decide.
Wes Streeting, thank you very much indeed.